Halio Dalio DND Family. It's your girl that answers to 3 names, and those are Davena, Nancy, and Devena. If you're old, if you're new to the channel, thank you for stopping by. It has been a while, bro, I am fighting for my life as it regards finding time to make videos. This video that I'm going to do today, though, I had filmed it already, edited it, uploaded it to my channel, and I rewatched it and I was like, no, I'm not gonna publish this one. So here I am redoing a video that I already did. It will be a video about what to expect on Practicum 2. If you're interested in this topic, continue watching. If you're not interested but you're here to support me, the girl with 3 names, continue watching. First things first, you know, when we're in first year, we go to the hospital or the health center first. And after the 4 weeks, we go to, if you went to the hospital, then you would have been rotated to the clinic. If you went to the clinic, then you would have been rotated to the hospital. And then that was just it for your rotation as it regards institution. However, in second year, every single week, you are rotated throughout different institutions, right? So what I mean, like, this week it can be at KPH, this week it can be at Surgeon Golden, next week it can be at Chess. Those who are going to go to UE, you know, you can be at UE this week, next week you're at Surgeon Golden, next week you're at Chess, right? So the first week for me, I was at 3 North, which is at KPH. I also did a video on that week. It will be listed in the description below, so you can go and check it out if you haven't as yet. Week 2, I was at Surgeon Golden Rehabilitation Center, and I also did a video on that. It will be linked below, so when you're finished you can go ahead and check it out. My third week now of rotation, I was placed at National Chest Hospital. I was doing 12-hour shifts, so I go Monday through Wednesday, Thursday, right? I was off the Friday, but I went from 7 a.m. to 7 p.m. at Chess for 4 days. Kill me, murder me, buried. Fourth week, I went back to KPH to 3 East. It is also on the same floor as 3 North. Week 5 and 6, I was at Mary C. Cole, also at KPH. The 2 weeks, I was placed at Mary C. Cole. Don't know why, don't ask me. Then for my last week, I was at Chest Hospital, and that is where we did our exam. It was 7 weeks of rotation, 1 week was 12-hour shift, and that's it. At the end, we needed 240. We needed 245 hours for this entire practicum. My second point is, different institution has different environment, has different policies, that has different protocols, has different ways of going about things, right? So you know, at KPH, if you have never been to KPH, I don't know how to tell you about UE because I've never been to UE. In first year at KPH, we did vital signs. That was our thing, you know. We do vital signs, we do physical assessment, learned how to do GMR there, gave a little sub-Q or IM medication here or there, even though I didn't did the course, but you know, just to get the practice. The nurse was like, you're going to do it eventually, so why not do it now? I'm here to supervise you, you know, so you take it because you want to learn. So yeah, in second year, you will receive a patient. They will give you 2, which, yeah, it's hard because you're not used to getting a patient in first year. Just say, do vitals for everybody, or do this for somebody, or whatever. Then you usually get a set patient. But in second year, you'll get a set patient. You maybe get 2, you may get 3. Then kill you. I don't think they're gonna get 3, probably 2. They will give you 2 when are really critical, when I have no just in another them somebody, they might give you, right? So when you get that patient, what you're required to do is receive the patient. So you're going to go introduce yourself, identify the patient, talk to the patient, do your physical assessment. You are going to go ahead and do your vital signs, and then total patient care, assist with care of patient for the rest of your shift and whatever. Yeah, so that is what you'll be doing. You'll be doing medications also, because we do pharmacology 1 in second year. So you'll be expected to know your drugs, you'll be expected to do your 3 checks, you'll be expected to serve the meds to the patient, educate the patient, and so forth, and document. You'll get some nice nurses, you'll get some that are not so nice, but as a life boy, and everybody are good, nice and chirpy. Just life reality. But there are some helpful persons, there are helpful nurses that will help you if you push out the effort to help yourself and whatever. And if you know what you're doing, just be confident, because we all were taught, and a lot of things that you don't know, we don't know either. We did not know in second year, but we pushed, we asked questions, we research, and don't serve no medication and don't make your nurse know. Show the nurse the MAR. You might cannot find a treatment chart there, let me be real, but if you find the medication administration record, the cardex, show the nurse and say, nurse, this due, and then when you pull up a nurse say, when you carry go give a nurse say. Don't go give no, you is not a RN, okay? Please don't do it. You will be writing in the patient's notes. Nurse might ask you to write it on one piece of paper, write in your book and bring it on shore before you transcribe it on the actual patient record. So that is that at KPH. At Surgeon Golden, you'll be expected to do about the same thing, right? You get a patient, you receive a patient in their vitals. The patient should need help with anything that you can assist with, you go ahead and you do so. You write your notes. At Surgeon Golden, them strict on the diagnosis, right? So make sure that you're studying your NANDA, you already know to write your care plans and everything, them strict on that. So make sure you write your diagnoses. Then you hand over, like when your shift is over, you read your notes. We had to do it every single, even if you were on morning shift. You read your notes from the receiver, go right back down to the last thing you did for the patient, to your closure saying, fair shift spent. Nursing care continues. But yeah, at chest, now it's a different environment. They're strict about time. If you're going to be late, notify one of your classmates that are there so that they can notify the sister, notify the nurse that is in charge for the day. They're strict on uniform, so you must wear uniforms, as in our aprons and our caps, right? We should wear that every time we're out in the clinical space. Your hair should be on your shoulder, just the old dress code of nursing and nursing students. You have to be in line with that. They do devotions, you get your patient, you receive your patient, you do your vitals and everything for your patient. The patient notes are placed at the patient's bedside on over bed table or trolley. So each bed has one of those tables in front of it, and the nurse's notes are placed and kept there. You cannot move it, should not move it, nor anything like that. You know that we should do our updates every hour, so I think that will prompt you. So when you go to the patient to check on the patient, that will prompt you to just make a jotting right there. So I think that is good. Unlike, you might reach like 1 o'clock a day and you can't find the patient notes. I think it's good tactics for what chest is doing there. Big them up. But yeah, you cannot be sitting and writing notes. You have to stand and write that. You cannot move from the patient bedside. Next thing, when it comes to medication, it's a teamwork thing for them. Like when it reach 9:30, because you know that you can serve medications 30 minutes before the due time or 30 minutes after the due time. So with them, what they do, when it reaches 9:30, 9:20, the trolley is being pushed out. They have a medication trolley. Trolley is being pushed out, and they start from bed 1, go all the way back to bed 20, and then them go over the meal section. As I said, the patient notes are kept at the bedside. Medication administration record is also there. So they check the MAR and see if the patient has anything due for that time, and if they have it due, then they serve it. Then they make a notation just the same. While one nurse is doing this patient, the next nurse is doing that patient. So if your patient have a 10 o'clock medication and you are not there at the bedside at the time when they are at the bedside, they will serve that medication. So it's a teamwork thing, and if you don't push out and show up, you might not get a chance to practice your skills. In second year, you might see the other nursing students doing dressing, and so don't feel bad. Do not feel bad. Your chance to go come when you have to go to dressing and you have to go do much dressing, because UTech does not teach us wound care in second year. I'm not saying that you shouldn't go and observe. I'm not saying that if a nurse is willing to say, okay, come and do the dressing, I'll be there to supervise, I'll be there to tell you da 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 da. I'm not saying that you should shy away from it or you should say no to it because you haven't done the theory. But don't feel away. Don't feel incompetent. You are not incompetent. Your focus is on medication, is on focused assessment, and it's on care plans for this rotation, okay? In first year, I don't know if you guys did the 3 days thing where you only go to practicum 3 days out of the week. It was like that for us. I don't know. It was because of the COVID situation or whatever. I used to go Thursdays to Saturdays. However, second year, you'll be going every day, Monday to Friday. As I said, you may have a 12-hour shift. You may have an 8-hour shift. It depends. So you should decide, or you should, try planning in your head, you're going to get about this eating lunch thing. Is it that you're going to buy food? Is it that you're going to bring lunch? But please do not go the day without eating. I know some persons might get disgusted because of the whole hospital situation and you might say nasty this, nasty that, something upset your stomach, whatever. But you are doing yourself injustice if you don't eat for 8 hours while doing so much work to help somebody else to get better. You're running yourself sick. That makes sense. Take your lunch break, okay? Take the break, no matter what nobody wants to say. Next thing is the practice care plan writing. I know my fellow UTech students, I know we weren't adequately taught this topic. It's a well-known fact. And you have to be scurrying around the internet ways to get about writing an adequate care plan. I know. I struggled with it too. I mentioned it in my vlog for Surgeon Golden. So, you're not alone. I'm still not good at it. I can only do a few here and there. But, practice care plan. Also, if you need to invest in care plan classes, don't make nobody tell you, say, a waste of time, a waste of money. No. You are doing what you need to do to better yourself. Me, this thing on my vlog, it that kill me. I was dying. But thanks to Miss Vaughn, VHSI Academy, for keeping that free care plan webinar like couple days before my actual exam. I think she kept it July 13th and I had my exam July 18th or the 20th, something like that. Me say, yes, if I never did the class day, but Miss Van keep my girl or my boy, whoever watching. Me tell you, me know my preceptor, the mother said to me, say, your medication administration was okay, but the care plans, I don't see them making sense. But on joke aside, practice your care plan writing. If you have a friend group, each person can take a diagnosis, a popular diagnosis, and write a care plan, and you guys come together and discuss it. Also, there are good nursing care plans and nurses labs. Granted, and everything I go accurate and everything I go up to standards. You have to pick sense with the nonsense. You understand? Also, if you want help with care plan or anything, don't know. Me not gonna tell us if it hit me up, because me want help with it myself. If you want help with care plans, send me a message on Instagram. My social handle is always on the screen. You can hit me up, give me your email address, and let me just send you a little book thingy. If I can even send it. You just send me an email so I can just send you that and make you see if you can use it and help yourself in some way. If you don't have the money for invest in a care plan class. But take advantage of the free care plan classes, or take advantage of the $1,000 care plan classes, or the $1,500 care plan classes that Miss Tisha Vaughn at VHSI Academy offers. Okay, you're not gonna lose. Me can't tell you that. For exam, you will be assigned one patient that you're expected to do a receiver on. Assess the patient, do their focus assessment based on the system that is affected. So why are they in the hospital, right? Say them in hospital because their foot broke, say you go do musculoskeletal as your focus. If them in the hospital because them have a chest tube, you go do lungs and thorax because others are affected. If them in the something because them have a heart problem, you're going to do cardiovascular. If them have something going on them belly, abdomen, anything in the belly were affected, say you go do the abdominal focus assessment. or you can do genitourinary. Any system affected, you're going to do your focus assessment on that. Okay, so practice your focus assessment, practice how to write on your focus assessment, practice how to go about getting information, subjective information from your patient for your focus assessment. Okay, whatever information is in your care plan, ensure that it is in your patient notes. Say the patient say my head hurt me and you plan to go use one acute pain diagnosis, make sure say it in the subjective data. Now the patient notes say patient verbalized or patient voiced my head hurt me, so you can put that in your assessment section. Subjective data jotted here, you're going to do total patient care, receive the patient, assess them, write the patient notes using the SOAPy method or whatever method the hospital uses. And if you're a nursing student, you know what I'm talking about. I don't need to, do I? Okay, alright, I don't need to. You're also expected to do medication administration the right way. So you're going to do your verification plus your 3 checks. Also, you're going to need to do, alright, they call it 1 care plan, right? But we call it 2 care plans because we're writing 2 diagnoses. So you have acute pain, right? You're gonna have subjective data, objective data for acute pain. You're gonna have the diagnosis, you're gonna have the outcome, you're gonna have the intervention, and you're gonna have rationale and the evaluation for acute pain. Say that you have a deficient knowledge diagnosis, you're going to have subjective data for deficient knowledge, you're going to have objective data, you're going to have your diagnosis, you're going to have your outcome for deficient knowledge, you're going to have your interventions, your rationale, and your evaluation for deficient knowledge, and that will comprise the 1 care plan, 2 diagnoses. Okay, I just need to lay it out because confusion. Yeah. Anyways, and that's that you can expect on Practicum 2. I missed any points, my fellow classmates or persons before me, you can drop them below and let the girlies and boys know.
Side eye. Side eye.
If this information was insightful, don't forget to leave a comment, don't forget to like the video, and don't forget to share it. Okay? And don't forget to subscribe. And if you have made it this far, then big up yourself. Thank you for your never-ending support. Thank you for clicking on the video. Thank you for watching. Until next time, stay safe, stay blessed, and big up on yourself. Bye bye.